Health Pathways is a process of getting people together, clinicians together, to talk about particular topics.
It's a process, but it's also an end point. We end up with a pathway that you can see on a website.
Most doctors are very well trained clinically, but this is a very complex system, and the logistics of how to get the right patient at the right time to the right person with as much detail as possible are really quite challenging.
It's an opportunity to make connections or improve the connections that are already there between clinicians in every part of the health service.
Gives us a one-stop shop to sort of improve consistency of care. Lots of little handy drop-down menus to allow you to access details, resources that you might want to print out for patients, or for finding a list of practitioners, or for finding what tests need to be done.
It's been an exciting year. In that 1 year, we've managed to develop over 100 pathways now live, and there's another 70 or so in development.
It's a living organism, so that it allows feedback from the people that are using it, so that it's not just going to be a static thing that finishes in 2014 or 2015.
The work party process has been very enjoyable because it combines GPs, both young and old, as well as specialists, so that we have a really good upstream as well as a downstream perspective.
We all work in our own little box and our own little area, and it's good to know sometimes why services maybe are difficult to deliver in our own local context.
The really exciting thing for me for Health Pathways is that we get clinicians together to talk about some of the issues. So far we've got nearly 90 clinicians who are in work groups. It's been an interesting way and an exciting way to get people to start to talk about some of the issues in the health system.
I've been involved myself with working on the work groups for some of the musculoskeletal pathways for osteoarthritis and osteoporosis, and I'd strongly encourage anyone to become part of a work group. It's a fantastic opportunity to work as a member of a multidisciplinary team. It gives you a chance to network with people from the other health professions and a chance to discuss the best evidence-based practice to form guidelines for treatment of conditions.
There's been an emphasis put on trying to get more local referral information there to make it as useful as possible for local clinicians.
Health Pathways is really easy to use. Hop on, log in, get a password and click on the pathway that you want.
I've really enjoyed the work that we've begun through the Health Pathways project. It seems to me the perfect platform to institute innovation and reform.
I'd just like to encourage all health professionals to access the health pathways and to utilise them for your own benefit and also for the benefit of our patients and also therefore for the community.